Hello, and thanks for tuning in again to our weekly COVID-19 update for Davie County. Thanks for taking time out to check with us every week to get the latest COVID-19 resources and updates and information that we have for you. We hope you find this valuable. Each week we try not to repeat ourselves just to do so. We try to get you pertinent information. If nothing's changed, we'll tell you. If there's anything that we feel like from an emergency operations center perspective you need to know, we'll tell you that too. Each week we also try to get any information from you, things that you may want us to address, but also questions you may have, things that you'd like to hear more of, and we'll show you how to get information to us at the end of our presentation today. As you know, if you've listened to this before, some weeks you'll just hear from the Emergency Operations Center. Other weeks we'll invite guests to join us. We do have a special guest today that I'll be introducing, and then you'll hear from our Emergency Operations Center team members that have pertinent updates for you this week. So with that, we'll go ahead and dive in to our presentation this week on behalf of the Davie County Board of Commissioners and Assistant Manager Robin West and myself, John Eller, Davie County Manager. We thank all of our citizens, volunteers, nonprofits, churches, our public servants, folks who work so diligently to help everybody in need, just for everybody coming together during this time and really lending a hand to the COVID-19 epidemic we're having. We know that things are fluid and change a lot, and that's why we're doing this weekly update for you. So with that, we're going to go to our first presenter today. We're honored to have Mr. Chad Brown here with us. Chad is representing our Davie Medical Center, and he is here to give some updates on COVID-19 as it relates to Wake Forest Baptist Health and what may be happening at DMC. So, Chad, I'll turn it over to you. Thanks for being with us today.
Yeah, thanks, John. I appreciate you having me, inviting me, and bringing me in so I can share with the community some updates on what's going on at Davie Medical Center. Certainly thank you for what you're doing, and a lot of folks that are going to be talking later after me for what you've done for our community, for our county, keeping us updated, keeping us safe, importantly, and continuing to keep us abreast of what's going on with COVID-19. Obviously, it's impacted all of our world, specifically at our local hospital here at Davie. So do appreciate that. So from the hospital's perspective, the last couple of days from the state perspective, actually, we've seen from a hospitalization standpoint, we've seen some record numbers currently I'm looking at today. And this is statewide, but hospitalizations that are at 915 hospitalizations across the state. So we're certainly seeing that kind of that surge of COVID after, in mid-March when we, as a hospital and as really as a health system, had tried to intentionally flatten the curve. We were very successful in that. Going back to that period, kind of mid to late March, when we really curtailed and stopped certain services, elective surgeries, just from a preparedness standpoint, just to make sure that we were prepared going into this. So specifically at Davie, we did do that intentionally to really prepare ourselves from a PPE standpoint and that sort of thing, just to be prepared. So after that, we May 5th is when we brought elective surgeries back online, and we did that in conjunction with a lot of our sister facilities in the Triad area. Wake did that specifically at Davie as well. So kind of a very purposeful, strategic, and careful, making sure first and foremost that we open up our services in a very careful, safe manner for our patients and for our community. So first and foremost, I want the community to know that. And if you visited our hospital recently, I hope that you have seen that in terms of the safe practices and things that we're doing, aligned with obviously with what Suzanne's doing at the Public Health Department and statewide. So we're seeing our volume come back to what we call pre-COVID numbers. So we're not at capacity per se. We do have some capacity as we're looking kind of in the future, and the future is hard to predict, obviously. I know you've probably talked about this on this call many times. amongst the county in terms of what we're going to be seeing, but a lot of modeling, a lot of continual prep efforts for making sure that we take care of the community, make sure that we're prepared and continuously engage in those efforts, so certainly doing that. So volume has certainly come back. I guess from a theme standpoint, just from the community perspective, it's not over. It's not doom and gloom, but it's not over. It's how to live with this. It's not when it's going to be, when we're going to be finished with COVID, but how we live with it, and from a hospital standpoint, kind of what that means. But we certainly were successful in, quote, flattening the curve, so to speak, and that's what we're really experiencing right now, kind of that offshoot of that. But the local hospital, we have our challenges. You've read, I'm sure, in the paper, or if you haven't, it's in the news for what hospitals have gone through, and but we are, from a long-term perspective, long-term sustainability. We've got a lot of great partners with Wake Forest Baptist and the resources that they provide to our local community. So we're very thankful for that, with PPE, with bed capacity management, other resources that we have locally, and to make our hospital strong. So we'll come out of the other side. Healthcare in general is going to look different. That's not necessarily a bad thing, but a good thing. So how do we continue to position healthcare in your local hospital for that? We've implemented a lot of initiatives from this with telehealth services and those sorts of things. So that will really, I think, reshape our industry as a positive, looking, first and foremost at our patients and what they need and how to meet our healthcare needs, not just COVID, but the healthcare needs of our community. So in short, the Davie Medical Center has been ready, is ready, continues to be ready, and are here for our community, for your healthcare needs. Things, if you haven't been in our hospital in the last 6 months, it may look a little different when you come in, but that's for your safety, for your health, and for our community's health. So just know that. And if anybody has any concerns or comments or anything that we can do for you, I hope that you would reach out to me personally or someone at our hospital. But we're here to serve. We're ready, and I appreciate the opportunity to provide this update, John.
Chad,
and I'm going to hand it over to you.
Okay, Chad, thanks so much. We appreciate all that our healthcare workers are doing. We know as you said, we're all doing business very differently right now, and we just appreciate the partnership so much that we have with DMC and the services you provide to our community. So thanks for joining us on the call, and thanks for all that you and your team do for us here in Davie County.
Our pleasure.
Okay, we thank Wake Forest for that update. We're going to go ahead and move on to our next presenter, Ms. Suzanne Wright, our Health and Human Services Director, to give us her update. Ms. Wright?
Thank you, Mr. Eller. Davie County has 172 cases of COVID-19, and that's a total case number since March of 2020. There were 21 additional lab confirmed cases since last Wednesday, and we have several more tests pending. One individual is currently hospitalized. The health department will be posting cases by race and ethnicity on its website and Facebook pages today. We will also be changing the frequency of posts and the way case information is communicated on these sites, because we realize that the way that public health tracks this information and the way that the public wants to see it are two different things. So we're going to try to make some changes there. And I know we continue to get calls and questions about antibody testing. I know Wake Forest is doing a research project, and if you're a patient of Wake Forest Baptist, then you can get enrolled in that research project. But I have some new information. The American Red Cross will be testing all blood, platelet, and plasma donations in North Carolina for COVID-19 antibodies. And donors will know within 7 to 10 days if their immune system has produced antibodies in response to the virus. I'm not sure when this new process will take effect, but do know that that the American Red Cross is planning for that. So you can reach out to the Red Cross to get implementation dates. And that's my update for today. So thank you.
Thank you, Ms. Wright. I know the state has also changed several times the way the reporting requirements are, and I know that all of you at Public Health continue to navigate that world and keep up with those changes. So thanks for that, and we appreciate the data you do report to us and all that you and your staff continue to do, from the hotline to help and support our citizens and departments each and every day. So we definitely appreciate the work, and it goes noticed, not unnoticed at all. It's very noticeable, and we thank you for that. We will move on now to an update from our sheriff, Mr. J.D. Hartman. Sheriff?
Well, good morning, everyone. Nothing new from the sheriff's office. We continue to work with the court system to prepare for jury trials to return sometime in August, hopefully. And also our jail continues to monitor folks in and out for the coronavirus. And that's really all I have for the day, Mr. Eller.
All right, Sheriff, thanks for taking time out to be with us. As always, we appreciate all that you and your deputies do for us. We'll transition now into our emergency services update. We have with us today Joseph Ashburn, our EMS chief. Mr. Ashburn, we'll turn it over to you.
Thank you, Mr. Eller. Brian sent me a couple of notes where he wasn't able to be in here today. We're looking at day 107 of the state of emergency. We're continuing to work with our employees, our county, state, federal partners to be able to work together to coordinate responses and resources for the COVID. I'd like to really say a thank you to the Triad Healthcare Preparedness Coalition. That's a strong partner that we have that's located here in Mocksville, right there on Bethel Church Road. These folks are working to get us supplies and be able to come up and fill orders that we have that we're needing for not only us, but other agencies. They've also got the National Guard in to kind of help with reinforcing what they're doing as far as logistics and deliveries out to the Piedmont Triad region area. So we're lucky to have these assets in our community. On the EMS side of it, EMS Fire Marshal's office, our call volume is staying pretty steady, but it's not overwhelming yet. With all the volume that we're having, and we're transporting more patients that's presenting with symptoms, so we're continually monitoring our staff daily, working with Ms. Wright and her staff as far as if we have anybody that positive wise, so we actually utilize them to do some testing on some of our crews. But all the tests have come back negative, so we've been very fortunate on that part of it. Like I said, we've got the Triad Healthcare Preparedness Coalition, North Carolina EM, the Office of EMS, local vendors, and we've had some donations as far as supplies that we've been able to go through to keep our guys safe, and been able to go through and provide for other agencies as well. One of the things that we're working on is this upcoming school year, we're trying to do some training with the school systems for the athletic stuff, just trying to be prepared, find out what we're going to need to do. And going back to what Mr. Brown had said, we're actually looking into the telemedicine using the Pulsera app to be able to communicate with our medical director on some of these calls, and we've got some protocols and policies in place in case we need to shelter the patients in place, their residents. So we're in constant communications with our medical director, and that's about all I have on the emergency services side of it. And I appreciate y'all letting me be on today.
Thank you, Chief Ashburn. We appreciate you very much, and thank you for all that you and our emergency services folks do for us. So with that, we'll transition on into public utilities updates from our director, Mr. Johnny Lambert.
Thank you, Mr. Eller. So Davie County is still working under the governor's executive order, and that executive order suspends all the disconnections of water. Right now, that governor's order extends out to July 29th, 2020. It also suspends all late penalties and fees associated with water and sewer. That also extends out to July 29th, 2020. We're still urging all of the customers of the utility to call our office if you have not paid your bill or cannot pay your bill, to set up payment plans with our staff. And the number to reach staff is 336-753-6090. And just like you say, we've had a lot of people call and set up those payment arrangements, so please do that. The next thing we'd like to talk about is ways to keep your building water system after a prolonged shutdown safe. The CDC has passed out guidelines for flushing your lines to do away with any taste or odor issues from the water that's been setting in lines. That information is available on the CDC website or the Davie County website. And if you have any concerns or questions with that, you're also able to call our office at 336-753-6090. And that's all we have for today, Mr. Eller. Thank you.
Thank you, Mr. Lambert. And a good reminder there that our utility staff, we're here for you if you have any questions, but also don't feel like you have to come in. We do provide an online payment option for you, and that service has been well utilized during this time. So, Mr. Lambert, thanks for all your help and for all you and your staff do for us. As we wrap up this week's update, we thank all of our speakers for being with us. Just one thing before we close. We said this before on past calls that the county's put in place, along with our town partners as well, mitigation efforts across several of our buildings and departments, really for the safety of the public and for our staff. I know that there are businesses that have reopened. The services that we provide are just that, they're services. And if there's an outbreak among the critical personnel who provide those services to our residents, we never want to risk being able to do that. And so because of that, we definitely have those mitigation efforts in place for everyone's best interest. The county is still open for business. We're still doing business, obviously in our departments as part of our government response to all of our citizens, but we are definitely taking those mitigation efforts to make sure we can continue to do that in a timely way and help support our citizens any way that we can. So I want to thank all our departments for doing that. I want to thank the public for their patience with us in how we're doing that. We hope that we're providing services either to you online, by appointment, or even in the field if needed, to really help even provide a better quality service, perhaps in more one-on-one service than maybe we even did before this. So as everyone's continued to change and innovate, we've tried to do the same thing and be more flexible with the way that we provide our services too. And we're doing all that to keep everyone safe. So thanks for your patience with us with that, and we'll continue to look at those different ways to do business to continue to serve all of you. So with that, we close. Every week we end here to let you know if there's any questions you have, things you want to hear more about, please feel free to go to the link that you have on the screen in front of you and let us know what those are. You can submit your comments or questions here, and we'll absolutely try to weave those in and look for themes every week. So with that, I want to thank all those who are serving. Our prayers go out to those who are impacted by COVID-19 right now, those families who have folks who have been sick or have passed away, but also all the people that provide services to those families experiencing this right now. I want to thank our speakers for joining us today. And Davie County, thanks for tuning in to us, and we will see you next week during our next recording. Take care. Thank you.